It's been more than 6 months since the coronavirus began its rampage from Wuhan, China. More than 13 million people have been infected by the deadly virus. The Wuhan virus has left more than 581,000 people dead. Instead of slowing down, the pandemic is accelerating. It has reached new territories, despite the best minds around the world seeking to develop vaccines against COVID-19. No cure has been found yet.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war.
In May, on this show, WION Wideangle, we debunked several conspiracy theories and told you how merchants of misinformation are all over the internet. This week, we go a step further and address some key issues that have emerged as the crisis deepens. Why are there so many conflicting statements about the nature of the virus from the scientific community? 6 months into the pandemic, why are we still hearing mixed messages on how the coronavirus spreads?
Asymptomatic cases, they're following contacts and they're not finding secondary transmission onward. It's very rare. And that much of that is not published in the literature.
How is it that the accuracy of COVID-19 tests still remain largely unknown? Did the lockdown work? Are we living through a pandemic, or is it a plandemic? Let's find the answers now. To begin with, let's get back to basics. Where did the coronavirus come from? Understanding how SARS-CoV-2 was created could be an important step in arresting a pandemic that's killed millions. How did a lethal virus jump from wild animals in China to populated urban centers? Could it have been intentional? What kind of genetic mutations have occurred to produce a pathogen that's so adept at mass transmission? Initially, authorities in Wuhan, China reported that the first cases of the virus emerged at the local Huanan seafood wholesale market. Now there is evidence that early cases of COVID-19 occurred outside of Wuhan in China and had no clear link to the city's wet market. Let's not forget that the city is also home to the Wuhan Institute of Virology, home to the leading bat coronavirus researcher, Shi Zhengli. Her group, one of the first to isolate and sequence SARS-CoV-2, has trapped bats in the wild for 15 years, hunting for coronaviruses to help identify pandemic threats. The vast majority of scientists who have studied the virus agree that it evolved naturally and crossed into humans from animal species, most likely a bat, but others believe that it was created in a laboratory. In other words, it could be an artificially constructed virus or a biological weapon.
This particular virus was known in the academic literature in October of 2019. It is not a novel virus, it is newly detected, and that's a big difference. Tulane University thoughtfully published a paper that suggested that it probably has gone through a series of mutations, increasing the mutagenicity and the morbidity of that virus and the effectiveness of it over the past potentially several years. If you go back to the binding receptor domains inside the virus itself, you find that the ACE2, which is angiotensin converting enzyme 2 receptor, which is where a hook for this particular virus makes this virus a particularly nasty one, that hook was identified in a series of variants that we found in 74 patents published since 2003.
We obtained samples in the afternoon of December 30th, 2019, and our team first carried out coronavirus studies on these samples, which were thought to be samples from a pneumonia of an unknown cause. We've performed high-throughput sequencing of the samples and the isolation of pathogens. And then in a very short time, we determined that there is a new type of coronavirus in these samples, which proves that this pathogen sequence is not the same as the existing viruses we already knew.
So is the outbreak human-made? While the virus's origin still eludes scientists, the WHO, an organization that has been accused of mishandling the outbreak, has finally sent a 2-person team to China to investigate the pandemic's origin. Are they likely to return with some answers? We aren't too optimistic. In the West, a growing number of conspiracy theorists are embracing this theory. They believe that death certificates have been knowingly manipulated by medical examiners to inflate the number of COVID-19 deaths. This theory has been propagated by the likes of English conspiracy theorist and former footballer and sports broadcaster David Icke and Candace Owens, an American political activist. The conservative pundit tweeted, "Turns out everyone is only dying of coronavirus now. Gee, I wonder why." According to sources, President Trump too has complained to advisors about the way coronavirus deaths are being calculated, suggesting the real numbers are actually lower.
The fact of the matter is that in every piece of data that comes out, and this is the Center for Disease Control's own numbers, so if this is wrong, they're wrong. Pneumonia is killing more people by at least 80 to 90% than COVID-19. But pneumonia isn't branded.
But U.S. infectious disease chief Dr. Anthony Fauci claims that the official numbers still underestimate the true death toll.
The first question is this just an increase because of testing versus an increase? Well, there's no doubt that it's both. I mean, obviously, the more you test, the more you're going to pick up. So increase in testing is going to give you increases. But there is no doubt that there are more infections. And we know that because the percentage of cases, of the cases that are tested that are positive, is increasing. Therefore, unequivocally, you're seeing truly more new cases. In addition, we're seeing now more hospitalizations, which lag behind infections. And we're starting, and we'll see, though not as much as we've seen, very likely more deaths. So clearly there are more infections.
Not surprisingly, the White House has been increasingly critical of Dr. Fauci. Meanwhile, the U.S. continues to see surges in COVID-19.
How many people have actually died from COVID-19 is anyone's guess. Again, God only knows. But based on how death certificates are being filled out, you can be certain the number is substantially lower than what we are being told. Based on inaccurate, incomplete data, people are being terrorized by fearmongers into relinquishing cherished freedoms. I'm sure you all feel so reassured the government is asking doctors to provide their very best guesswork. Not. Fact, quote, COVID-19 caused death, end of quote, and quote, assumed death by COVID-19, end of quote, are not the same thing. And for those who died from something else and had an incidental finding of COVID-19 positivity, dying with COVID-19 is not the same as dying from COVID-19.
This is a Montana-based physician named Dr. Annie Bukacek. She can be seen questioning the number of COVID-19 deaths in the United States. People are being terrorized by fearmongers into relinquishing freedoms, this doctor claims. She is also rallying people against the lockdown. Demonstrations against coronavirus lockdown measures have been sweeping across Europe and the United States.
USA! USA! USA!
More than a fifth of people believe that the coronavirus crisis is a hoax, according to a new research conducted by the University of Oxford. The team of clinical psychologists state that the data from the survey indicates a large number of adults in England do not agree with the scientific and governmental consensus on the COVID-19 pandemic. Countries across the world relied on complete or partial lockdowns as a strategy to reduce COVID-19 spread. China, Italy, Spain, India, Germany and France were among the few countries to impose some of the longest and most stringent lockdowns. But was it necessary, or did epidemiologists get it wrong? Whether the lockdown was necessary or not is a matter of opinion.
For 17 years, we've known of mutations and alterations in the genome of the coronavirus, and to suggest that we know that there is one, COVID-19, is ludicrous. There are several. And by the way, several doesn't mean that we shut down countries and we shut down economies and we collapse the markets, because it turns out that that wasn't justified before, and if it's being done now, and listen very closely to this, if it's being done now, it's being done for another reason. That's not a conspiracy, and it's not a theory. That's evidence based on covert actions that we've done in the past, and covert actions that we've done in the past will be made public at some point in time.
Taiwan, a nation just 100 miles off the coast of mainland China, has been praised for its highly effective COVID-19 response. With nearly 24 million citizens, it has recorded only 450 cases and 7 deaths until now. It has proved researchers at the Johns Hopkins University wrong. They had predicted that Taiwan would have the second most COVID-19 cases in the world, given its physical proximity to China. Rapid isolation, digital tracking, and a mistrust of China are the main reasons why this country succeeded in beating the virus. This is a bottle of a miracle drink that is supposed to save you from COVID-19. Or so Madagascar's president, Andry Rajoelina, believes. COVID Organics, a herbal tea made from Artemisia, a green fern, is presented as a remedy against the deadly COVID-19 pandemic in the African nation. COVID Organics proponents tout it as an effective treatment against the coronavirus, but its detractors, and there are many, dismiss it as an overly hyped, useless drink. Another dubious product, you are looking at Japan's shutout necklaces. Tuamit's virus shutout claims that it is experimentally proven to effectively block airborne particles and bacteria, as well as various epidemic viruses, reducing the chance of being infected or infecting others. The manufacturer also maintains it is suitable for the sick, elderly, children, and people with low immunity. However, the so-called antiviral product has been banned around Asia. The crisis has seen various companies introduce these kinds of non-verified remedies. In India too, Patanjali launched an Ayurvedic concoction called Coronil as a cure for COVID-19. However, it was accused of violating clinical trial norms and is now available only as an immunity booster, not a cure. spreading as fast as coronavirus, it seems, are conspiracy theories. In this viral video, Dr. Judy Mikovits blames the coronavirus outbreak on a conspiracy led by Big Pharma, Bill Gates, and the World Health Organization. The film, called Plandemic, has been banned on all social media platforms, but to summarize, the controversial virologist claims that US health agencies buried her research, showing vaccines weaken people's immune systems. She also asserts that wearing masks is dangerous because it literally activates your own virus. So why do people oppose vaccinations? There are lots of reasons, and a distrust of pharmaceutical companies is one of them. However, despite what the anti-vaccine folks would have you believe, the benefits of vaccines are undeniable. And these kinds of medical conspiracy theories can have very dangerous consequences. On the 13th of July, US President Donald Trump retweeted a post by game show host Chuck Woolery. The conservative Woolery, who hosted shows such as Love Connection, wrote in his Twitter post, and we quote, "The most outrageous lies are the ones about COVID-19. Everyone is lying. The CDC, media, Democrats, or doctors. Not all, but most that we are told to trust. I think it's all about the election and keeping the economy from coming back, which is about the election. I'm sick of it." So why did Trump retweet this post, which takes potshots at his own health officials? Let's just say it's not the only time he's left us puzzled.
We are analysing that data to see exactly why people are refusing, but it is concerning that the report that I have received is that some people believe that coronavirus is a conspiracy or that it won't impact on them. So what I want to stress here is that coronavirus is a very contagious virus.
In Melbourne, more than 10,000 people have refused testing. Victoria's health minister, Jenny Mikakos, blamed conspiracy theories for this bizarre act of defiance. Coronavirus conspiracy theories are hampering efforts to contain the virus in other countries too. In England, an online survey of about 2,500 people conducted by Cambridge University Press found that 25% believed that the pandemic was a planned outbreak. So it's not surprising that conspiracy theorists are able to successfully peddle their ideas, however outlandish they may be. We've heard them claim that 5G, the next gen of mobile networks, is in some ways responsible for the disease, since a rapid rollout of 5G networks was taking place around the time the pandemic broke out. Misinformation about 5G waves transmitting the virus spread like wildfire. These were cited as possible motivation for multiple cell phone tower fires across the United Kingdom. Microsoft co-founder and philanthropist Bill Gates has long been a target of conspiracy theories. One of the world's richest men, Gates has been linked to false claims about using a vaccine or a test to secretly microchip the population. Remember this speech from his TED Talk? It was filmed 5 years ago.
If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic.
The video of this talk has now been viewed more than 64 million times. Anti-vaccinators and conspiracy theorists see this video as evidence that Gates planned this pandemic to grab control of the global health system. Sounds crazy? Well, listen to this. The internet is also flooded with posts that claim that Gates is trying to depopulate the world. Other theories cite his acquaintance with Jeffrey Epstein, the disgraced financier who was convicted of sex trafficking and committed suicide. saying a global elite had band together to create the coronavirus. These theories have real-world consequences. In a recent survey, 24% of Americans say they will refuse a coronavirus vaccine. Some celebrities have also expressed skepticism. The outspoken British rapper MIA, who has a huge social media following, tweeted this: "If I have to choose the vaccine or chip, I'm gonna choose death." Tennis star and current world #1 male player Novak Djokovic has also expressed his reservations. He said, "Personally, I am opposed to vaccination, and I wouldn't want to be forced by someone to take a vaccine in order to be able to travel." Experts believe that this anti-vaxxer movement could seriously undermine a future inoculation program. Is the second wave another coronavirus hoax? That was a question asked by former US Congressman Dr. Ron Paul in his column. The former Republican presidential candidate suggests that Democrats are abusing their power by perpetrating a hoax.
Is the second wave another coronavirus hoax? Just a week or so ago, the mainstream media and thousands representing the medical community told us we must throw out the stay-at-home orders and go to the streets to protest the death of George Floyd at the hands of the police. The COVID-19 virus will not bother people who are protesting this injustice, they said. The virus only attacks people leaving their homes to protest the stay-at-home orders.
An infodemic is an excessive amount of information about a problem, making it difficult to identify a solution.
This is one of the several videos uploaded by the World Health Organization on various social media platforms to combat misinformation. But it's the same organization that has misled people with its COVID response. In February, the organization said that there wasn't enough medical evidence to support members of the public wearing a mask.
WHO only recommends the use of masks in specific cases. If you have cough, fever, and difficulty breathing, you should wear a mask and seek medical care. If you do not have these symptoms, you do not have to wear a mask.
4 months later, it said masks must be mandatory.
In light of evolving evidence, WHO advises that governments should encourage the general public to wear masks where there is widespread transmission and physical distancing is difficult.
In June, the WHO retracted this statement within a day. It scrambled to clarify its comments that transmission of the coronavirus by people who never developed symptoms is very rare.
What proportion of asymptomatic individuals actually transmit? So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare.
The remarks by Dr. Maria van Kerkhove, head of the WHO's Emerging Diseases and Zoonosis Unit, drew skepticism from physicians around the world.
We're also looking at the possible role of airborne transmission in other settings, particularly closed settings where you have poor ventilation.
It even acknowledged that there is evidence that the virus could be airborne, a claim that was dismissed during the onset of the pandemic. This came after a group of scientists urged the global body to update its guidance on how the respiratory disease passes between people.
And they're a puppet of China.
Is the WHO a puppet of China?
The Wuhan virus is spreading rapidly in new territories.
WION has been exposing China's criminal negligence in dealing with the coronavirus pandemic and showing you how the UN health body was uncritically repeating information from the Chinese authorities. So where are we heading now? There is little doubt that the world is paying a price for China's deadly secret, but science will get us through the crisis. Misinformation about COVID-19, be it from conspiracy theorists or health bodies, leads to greater uncertainty. Honest and effective communication of scientific findings is the only way to cut through the fear of the unknown.